Tonight we're going to be focusing on a safe and healthy community. And one of our Spanish interpreters has a message in Spanish for our Spanish speaking guests about how to access Spanish language interpretation and tonight's PowerPoint in Spanish. Daniela?
Muy buenas tardes. Bueno, para escuchar o participar el día de hoy en español, por favor, vayan a la parte inferior de su pantalla, elijan en globo terráqueo la opción de español. Si escuchan dos voces y les interrumpe, pueden silenciar el audio original. Vamos a poner la presentación también en el chat para que ustedes la puedan leer y la puedan seguir. Caso contrario, también nos pueden seguir en Facebook Live para que puedan asistir a este evento. Muchas gracias.
Thank you. And that was Danielle, not Daniela. Thank you so much for that information. Supervisor Hashak.
Well, thank you. Good evening, everyone, and welcome to this town hall about our strategic plan for Mendocino County. I'm John Haschak, 3rd District Supervisor, and this process started 1 year ago as an agenda item to do a strategic plan, because it seems like so often the county is reacting to the crises at hand. And this is an opportunity for us to look forward, to be proactive in how we're dealing with issues and what the issues are, and coming up with a common vision for everyone. So we're so glad that you're spending the time with us this evening to share your thoughts, your ideas on where we want to go as a county. And this is a very collaborative effort. I don't know if Supervisor McGordy is on, because he was the other part of the ad hoc that's been working with our consultants and getting this process moving. So is Supervisor McGordy on yet? So if he's not, I'd just like to present our presenters, BJ Bischoff and Gary Hockman, who have been really instrumental in helping guide us through this, this process of strategic planning. So again, thank you all for being here tonight, and we welcome this great evening of strategic planning.
Thank you, Supervisor Hashak. Just let's go ahead and go to that next slide if we could, Anne. And we'd like to share with everybody what's in store for tonight. So if we could have that next slide, that'd be great. So today we're going to talk a little bit about our planning process. And we're going to be looking also at the 4 strategic plan priorities that we've created through a very in-depth process. We'll talk about that. And then we're going to share with you some draft goals for having a safe and healthy community. And that's one of the 4 priorities. Then we're going to get your feedback about your recommendations for what we can do to have a safe and healthy community. And then we'll also want to get your ideas for additional ways to have a safe and healthy community other than what we're presenting to you tonight. So I'm one of the co-facilitators, and with me is Gary Hockman. Gary, can we see you there? And go ahead and make a couple comments if you want, and then go ahead and we'll introduce Anne, our project manager.
Great. Thank you, BJ. Yeah, as Supervisor Hashak mentioned, it's a delight to be here. We have some good work product to share with you, and we're looking forward to getting inputs from the community to move this down into final approval form. There's been a lot of input and time put in by the employees and members of our task force, and now we're coming to you to get your ideas and edits to help us finalize this. So I'm delighted we could be here with you and look forward to the conversations and inputs we'll have tonight. I will turn over to Anne Mulgard, who's our project manager, and is it the interim director now for public health, Anne?
It is. So it's been a delight to work with the Board of Supervisors ad hoc and our facilitators, and really the over a dozen focus groups and different ways we've communicated with people. We've gotten a lot of input, staff surveys, and then public input, and then it's kind of culminating in these 3 evenings, but we actually still have a couple more focus groups to do as well. So you'll find lots of information in the chat that you can see where to go for additional information. You can also keep writing to us at GOVT strategic plan at mendocinocounty.org if there's anything that you don't get a chance to say tonight, but you want to make sure is included. And then we'll be putting all this together and heading back to the Board of Supervisors with the hope that this will help us focus a bit more, knowing that we don't always have all the resources we need to do everything we could dream of. But that's why we need to plan. Thank you.
Thank you. Thanks, Ann. Go ahead, Ann, and go ahead and go to that next slide. And while you're doing that, I would just like to give Supervisor McGordy an opportunity to say hello because he's one of our 2 ex officio members of our task force.
Oh, hi. Thank you, everybody. I think Supervisor Haschak summed it up great along with Ann's comments. So I'm not going to say any more other than there is these emails that were bouncing around between my 3 email systems, and I finally got the right link. So that's why I'm here.
Well, we're glad you did. Let's go to that next slide, Ann. So let's talk about our process tonight. The county supervisors and employees, and you see them on your screen there, you see those employees from the county, and our planning consultants. And by the way, Gary and I, and also Sarah, you'll see Sarah just a little bit. We're just from down the way, not too far away from Sonoma County. We're going to explain our planning process and describe the draft goals. And then we're going to stop throughout this conversation and ask for your thoughts and ideas on how we can have a safe and healthy community. And we're going to also encourage you, if you can, to attend the community conversation, also called the town hall, tomorrow night from 5 to 6:15. And that's about a thriving economy. And then Thursday, also 5 to 6:15, on how to have a prepared and resilient county. We really wanted to break it down in different sections so that we can really go into depth on each of those nights. So let me tell you who is with you today making this webinar happen. So Ann, let's go to that next slide. And we have Maya Stewart. And Maya is with Public Health also. She's the coordinator for our town hall. And she's going to be checking to see if any emails come in tonight. And also she's checking posts to YouTube and Facebook. Scott Spears is our technical director from Information Services. And we have 2 interpreters with us tonight. We have Daniel Tamayo and Daniela Guanipa, and they'll be providing our Spanish language interpretation. Sarah Sturch, Gary Hockman, and I will be co-facilitating. Now, we're also pleased to present on the next slide the members of our task force. And these are all members of the Mendocino County employee workforce who have stepped up and have volunteered their time to really help to plan the strategic planning process and go through everyone's input and help to come up with goals and objectives to share with the Board of Supervisors. It's really an iterative process back and forth. You've already met Ann. Buffy Barasa is not with us tonight. She's from Behavioral Health. And Katie Ford is with Human Resources. Elizabeth Garcia, you will see her. She's with Agriculture. She's going to try to keep us on time tonight. We have Eisen Locatelli from Probation. I believe he's on tonight as well. Michael Oliphant from Planning and Building. Megan Van Sant is on. She's with Social Services. And these folks will be helping to address any issues or maybe explain some of these objectives we're presenting in a little better way. And then you've already met Supervisors McGordy and Haschak. So just to let you know that Ann Mulgard, our fearless project manager, is also managing our PowerPoint tonight too. So you'll hear me say Ann, next slide, and that'll be for Ann. Speaking of that, next slide, Ann. And so we're going to look at our the procedures for tonight. So on the next slide, we really encourage you to put all of your comments in the Q&A. So at the very bottom, you probably see that Q&A. Sarah, do we have any comments in that Q&A yet coming in?
Not yet.
Okay, so we need the slideshow up there, Ann. So if you want to go ahead and grab that and share that screen, that would be great. And then we've deactivated the upvote function. That's the thumbs up function that you normally see. We've deactivated that. And so we're going to ask you to reply directly to people's comments as opposed to using the upvote function. Just go back one slide if you would, please. And then we're also going to let you know that if you can't access us via Zoom, perfect, Ann, we're going to ask you to email us at govt strategicplan@mendocinocounty.org. So we'll be keeping that open and we'll be mentioning that throughout the evening. I want to mention tonight's session is being recorded, and we're going to ask you to use respectful language, please, so that we can show respect for everyone. Plus, there may be little ones present in your background. I know many of you may be home. So let's go to that next slide. I'm going to just kind of put everything in context about what strategic planning is and why we're doing this. I know Supervisor Hashek shared with us that we're really doing this to really help us set our priorities, focus the energy and resources that we do have, strengthen the operations of county government, and really it's to make sure that everybody's working toward common goals and to establish agreement upfront on the results that you want to see. And it's strategic planning is a really effective tool for being able to adjust the organization's direction, especially in response to a changing environment. And we have seen our environment change dramatically over the last 4 or 5 years. Let's go to that next slide, Anne. And on here, we're just going to talk a little bit about the characteristics of a strategic plan. And it involves community input, which is why we're here. We don't develop a plan in a vacuum. And it sets priorities to achieve the desired future that we want. It defines specific goals and actions to achieve priorities. We're going to share some of those that we've developed in a draft format with you to get your feedback on. And it really allows the staff to align their activities and duties so that they know that what they're doing is in alignment with the priorities set forth by the Board of Supervisors. But it also allows flexibility, and that's really, really key. Gary's going to share with you a little bit about the process that we've been involved with since July. Let's go to that next slide, and Gary can explain that process.
Thanks, BJ. So this is just a little more context before we solicit your inputs. On the left-hand side of the page is a description of the timeline we followed. We actually started this process about 6 months ago, conversations with the Board of Supervisors as well as the CEO, and then went to build an initial strategic plan framework, creating 4 key priority areas. And we brought those to the department heads to solicit their input and to discover what was possible in terms of setting goals and objectives for the coming 5 years. So this is a 5-year strategic plan. Based on their input, we created another draft with the task force's help, and then went to the employees via a survey as well as internal focus groups to solicit more input. Did another iteration of the plan, and then started going to the community. So we've held several focus groups as well as some interviews in the community to revise the plan again. And now we're coming out to all of you to get more input in the form of these town halls to start moving towards finalizing the plan and bringing it to board approval. So about a 6 or 7 month process on the left-hand side of the page. On the right-hand side, you'll see the nomenclature we've been using for the plan. It's really based in 4 key areas. We call them pillars or strategic priorities. And then under each of those areas, if you will, there are several goals that we'll review tonight. We'll review goals in one of those areas. And the goals are broad statements about outcomes we're looking to achieve. And then if you double click, if you will, on the goals, we'll get to the objectives. So these are a little more finite, and they're particular initiatives or measures of progress that we need in order to achieve those goals. The plan doesn't include specific action plans or owners at this point. A lot of that work will be done once the broad plan is approved by the board. Next slide, Ann. And the last thing we want to share with you before we dive into the content are the 4 strategic priorities. So these are the 4 pillars, if you will, or the 4 areas in which the rest of the plan is cataloged and categorized. One of the areas is very internally focused, particularly on county operations, and that's the one in the center, an effective county government organization. We won't be covering that in the town halls. It's very much about the organization itself. The other 3 priority areas, safe and healthy county, a prepared and resilient county, and a thriving economy, will each have their own town hall. Tonight, we're talking about a safe and healthy county. So I think with that, BJ, we're probably ready to start moving towards the goals.
Absolutely. Let's go to that next slide. And before we go through this, would one of our interpreters just make sure to announce to our Spanish-speaking guests who may have joined us late about how they can access information in Spanish language? Wondering if that's possible. Okay. Let's go through these goals. We have 5 goals that we've developed. about creating a safe and healthy county. And what we'll do is we're going to explain these goals. We're going to go through these goals right now, and then we're going to go deep into each one of them because around these goals, we have some objectives, and then we're going to want your feedback on each one of those. So we're going to want your feedback on A, B, C, each one separately. So let me present all of them first, and then we'll go through them one at a time. So the 5 goals that we've established are to provide a person-centered approach to help under-resourced and vulnerable individuals and families thrive. And we'll explain a little bit more what we mean by person-centered approach. The second one that we've established in order to create a safe and healthy county is to deliver culturally relevant public health services that focus on prevention and are guided by social determinants of health. And we'll talk a little bit about what social determinants of health are. And many of you may know what those are, but we want to just make sure everyone's on the same page. And then the third one is to increase access to behavioral health services. The fourth one, help people feel safe in their communities. And that fifth one is to implement practices that support a sustainable environment and responsive stewardship of natural resources. And I just want to thank our interpreters for putting in the chat the information about how to access the Spanish language information. Thank you so much for that. So let's go to the very first one, and Gary's going to explain what the objectives are around that first goal of having a safe and healthy county. And let's go to that next slide.
So this next slide corresponds with the first goal under safe and healthy county that BJ just introduced. And if you'd like, if you see something on the page that you agree with, or if you'd like to augment the idea, you can start responding in our Q&A. So you can click on that tab and type in your comments, whether you think something's a good idea. You can amplify the idea if you have other ideas of how to satisfy this goal or to make these objectives more complete. Please throw them in as we're talking through them. So under the goal of provide a person-centered approach to help under-resourced and vulnerable families thrive, there's 3 objectives. The first one says enhance collaboration among departments to provide a one-door approach to services so community members can access services from multiple departments through one point of entry. The second is in partnership with local community-based organizations, design and implement approaches to providing families easier access to programs and services that match their needs, including providing both printed and online information and satellite offices. And the third and last on this goal says support community partners' efforts to achieve food security and improve nutrition among county residents. So again, we would love to start seeing your input. If those objectives look good to you, you can let us know via the Q&A. If you have suggestions on how we can enrich this particular goal through augmenting or changing some of these objectives, we welcome that input as well too. There have been some questions, and maybe I could just get a quick response from you about this notion of one door. There's a lot of different departments that provide social services to members of the Mendocino community. What does one door mean, this one door approach? Can you share maybe what that implies?
So basically, we want to make it easy for people to come and get the services that they need, rather than having to go to 3 different offices or call 12 different phone numbers in order to get where you're going. It's our job in the background to make things seamless for the public. Now, that takes a lot of expertise and commitment, but that's really where we want to head. It shouldn't be a person who's in need's job to figure out where in a bureaucracy they need to enter.
Great, good, thank you. And we're seeing some questions come in. We won't have time to answer all the questions today. One of the conversations we've had is that the county will put out a FAQ in response to some of the questions we see today. But if you have specific ideas, those would probably be easier for us to address or integrate into the conversation tonight. The third one, we've also had some question about community partners around food security. The community partners are other nonprofits and other organizations in the community that are natural partners to the county government and would be really instrumental and frankly essential in helping to achieve food security across the county.
Great. Well, let's go ahead, Gary, and see what the people are saying, what they'd like to comment about. Let me tell you how we can do that. So let's go ahead and go to that next slide, Anne. And we're going to ask you, what are your thoughts about providing a person-centered approach to help under-resourced families thrive? And the way we're going to ask you to do this, we want to ask you to think about, do you like the objectives that were presented for this goal? What don't you like? What more should we be doing? How can we build on what we're already doing in the county to make sure that we're providing a person-centered approach to help under-resourced and vulnerable individuals and families thrive? And we want you to type your comments in the Q&A, or you can email us at govtstrategicplan@mendocinocounty.org. Don't worry about your typing, spelling, any of that. We'll take care of that. And then Sarah, Gary, are you seeing any comments coming in? Sarah, what are you seeing?
I'm going to defer to Gary for one moment. I'm assisting one of our attendees here who privately texted the hosts and panelists. So if I'm just going to reach out to her really quick. Excuse me.
Okay, Gary, what are you seeing coming in?
Well, there was a question they're mostly questions at this point versus suggestions. There was one comment about community gardens providing food security as well as improved mental health, and that could be a strategy that's engaged. There's questions about what does collaboration look like, and I might ask Megan or Ann just to comment too about what kind of collaboration might be required in order to move closer to one door. We've talked a little bit about maybe sharing grants across departments and working in a different way. Megan or Ann, anything come to mind in terms of how these unique departments might organize or might collaborate differently going forward?
Sorry, this is Megan. I was reading the questions, so I was trying to look at the comments, and as I was following what you were saying, Gary, one of the questions or comments is, will there be one person or department? This is from Finn Alden. Will there be one person or department that will help a person find the help and resources they need? So in my opinion, ideally, yes, you would have like just a one-stop, really honestly, a one-stop person who is kind of the maven who can get you to the right place. As a community, we've tried this in different ways. We have 211, but it's not been quite what we've wanted. So I don't know if that's exactly what this individual here is suggesting, but I do think that I agree. And from what I hear from the constituents that I work with and the people in the community that we work with, I agree with Ann, they don't need to know all the backstory. They want to know how to get the help that they need. So a centralized place to get that help is important. It's not important for someone to understand how county bureaucracies work. It's important for them to get the help that they need.
That's right.
But I think we have a long way to go in this. We have a long way to go. I also see Mr. Hickey mentioning that all of these different departments, he's pulling in a lot of different ideas. The library system, probation, everybody together needs to work together. That's a big task, but would be, really a game changer if we could figure out how to do that as a county.
Yeah, one of the things I think our community members should know too is that classically a lot of these departments have gone for money independently. And I think part of the strategic planning process has surfaced an opportunity for more collaboration and grant funding too. So bringing the money in together with an aim towards delivering service together would start changing the frame versus working independently. And I think that to your point about looking at this holistically, we expect that a lot of departments will have a role in achieving these goals. These goals aren't going to be assigned to one department to achieve. The accountability and responsibility will be spread out across time.
Right. I see another comment that's come in that we need more resources such as affordable quality childcare and housing options. And we'll get to housing in a little bit too. And plus, I think tomorrow we'll be discussing housing in even greater detail. Sarah, are you back on? You seeing anything?
Yeah, I have been. Yeah. And, we want to hear all your ideas, whether they're pie in the sky or what maybe others would consider mundane. We want to hear every idea. And so let us hear it all. And again, you can always email us when you have ideas. And we're using the Q&A just so we can be, let the community engage one another also. So if you see a comment or an idea that another person posted or a concern, you can also type a response to them like, yeah, I agree with you. So we welcome that. We also have an anonymous attendee. We also love when you use your real names, everybody. So we can give you some love. So Anonymous says that these are logical and positive objectives. However, they do wonder about how the collaboration and the one-door approach will be achieved, particularly with the outlying regions such as the coast and Covelo. Thank you for that feedback and concern. We're also actually getting some private chat messages from an attendee named Kathy Johnson. I did reach out to Ms. Johnson, and I hope she'll consider participating in the Q&A here so everyone else can see her ideas. But she shares that objectives 1 and 2 align with the master plan for aging's goals to be implemented in part by aging and disability resource centers. Is there interest for our county to move towards or to support our area agency on aging and independent living centers to collaborate with? And we also have a few other ideas from her. I'll either save it for now or I'm going to, we'll make a note here and we'll definitely be sharing those in the report. Thank you, Kathy.
I might add too,
Go ahead.
might add too, before we move on, that anytime you want to comment, even if we've moved on to another goal, your comments will be logged and become part of the public record. So even though we're moving on with different pages, feel free to put your ideas in there.
Absolutely. And also emails after the fact too. We're going to accept those emails for a long time. So go ahead and get those emails in. And Kathy, ironically, I was just reading that master plan just last week. So thank you for reminding us about that. So the next slide, we've just looked at we're going to now look at delivering culturally relevant public health services that focus on prevention and are guided by social determinants of health. So get ready, Anne. We're going to ask you to help to define a little bit about what that might mean. And what the objectives are under here that we want your feedback on is to review public health programs to make sure that they're based on sound research and that they lead to positive results and they focus on prevention so that we're offering programs that we know work. And the second one is to make sure that we fill open jobs to ensure adequate staffing for effective program delivery. There are open positions, and when positions go unfilled in the county, it means you can't get as much work done. And so the goal is to get those jobs filled. And the third part of this is to implement the Public Health Department's 6 strategic priorities. Now, the Public Health Department has already established what they think are the most important priorities for their department and to support that. And those are to improve emergency preparedness, external communication with the public, immunizations, the culture internally in the organization, prevention activities, and then collaboration among the staff and the community. And Anne, as our interim director of public health, you want to talk a little bit about prevention and what social determinants of health possibly mean? Many people know, I'm sure, on the call, but just to clarify.
Yeah, so what we mean when we're talking about social determinants of health are those things that surround us when we're born and what we live through and all those different things that have an effect on us. So it's not just the biology that we had when we were conceived. It's the social, the cultural, the physical, climate, everything that surrounds us as we grow. And so it's kind of like taking that phrase that we've all heard, nature and nurture. It's nature and nurture plus, because we now realize that both nature and nurture are so much bigger than we realized originally. And that's really what public health is all about, is looking at things on those broader scales, not on individual health of each individual, but rather how all of these things affect the individual's health.
Got it. Any of our other panelists have any comments on this before we open it up to our public? Any other comments from our panelists about this, about public health services? Okay, let's go to that next slide, Anne, and ask you to tell us, what are your thoughts about delivering culturally relevant public health services that focus on prevention and are guided by those social determinants of health that Anne was talking about. Again, we want to know what you like about the objectives that we presented, what you don't like, what should we be doing that we're not, what can we build upon that we're already doing. And again, just to remind you, the email address is govt strategic plan at mendocinocounty.org. Sarah, you seen anything coming in? And Gary, Sarah?
It looks like we have some nice comments coming in from Facebook saying that the food bank in Fort Bragg is a great resource. And Kathy W. asks if the PowerPoint will be available. And I'm going to ask that our friends who are monitoring the Facebook page to please link to the county's website, which I'm going to also post in the chat right now, that has the links to these PowerPoints. You can look at them right now. You can look at tomorrow's PowerPoint and Thursday's PowerPoint. There's the link. So you can download them and take notes and report back to us at that email we've been posting. And let's see, we also have some other comments coming in. Again, your questions, we probably won't be able to answer too many tonight, but we're really excited about these ideas and constructive criticism we're receiving. Walt suggests that the county needs to establish metrics for measuring success and transparency in reporting results and address deficiencies and timelines to successful accomplishments. Thank you for that comment, Walt.
And I just want to throw in there that is what we're setting up after we decide on the priorities. So the priorities will be voted upon this month by the Board of Supervisors here in January. And then starting the day after that happens, we'll be setting up the metrics. Most departments have already started this work, but making sure that the work that's happening in the departments is coordinated and part and parcel of this strategic plan, and then transparent to the public is what our job is really as soon as we decide on the priorities. We completely agree with you. Otherwise, it's going to be a book on a shelf.
Yeah, thank you, Ann. I think that's so critical in every department. We also see a comment, Sarah, about the HR hiring system. And Mendocino County, like so many counties and so many employers today, is really struggling to bring people in the door. And so the comments well noted, and it ties in with the housing crunch too in Mendocino County and the price of housing. We heard about this extensively, particularly from the employees, and many of these objectives are aspirational, and without the staff in place, they'll be very difficult to accomplish over the next few years.
Right. And it looks like Supervisor Hashak would like to share something.
Well, thank you. Just talking about culturally relevant public health services, and I've heard a lot about delivering those services to people where they are in a culturally sensitive way, so that people aren't having to come into an office to receive whatever service, that we can meet them where they are.
Yeah, I appreciate that, Supervisor. That's actually embedded in the first goal as well, to try to do more satellite work out in the community versus expect people to drive to Ukiah to meet with somebody or to get the support that they need. And although the world's transformed into a virtual and online marketplace for so much, there are people that obviously can't get to the services they need. And so to have local support is absolutely critical.
And that really relates back as well to our goal about broadband that we'll be talking about. I don't think it's tonight, but it's one of the nights.
Yeah, tomorrow night.
Great. It's hard to do that in a county like ours without a really strong broadband. And that's what we've certainly learned through the pandemic, that there have been some upsides in terms of those areas of the county that can't drive into the county seat for a meeting twice a week, but have been able to participate when the broadband's good enough, when the connection's good enough through the internet.
Sarah, we got an amen from our anonymous attendee too on the focus on prevention, that they would love to see more of that work by the county versus reactive work.
Yeah, and it looks like they also have mentioned, speaking of, an inclusive form of public health care, is the county going to be incorporating community health workers and or the promotores in the components of this plan? And I believe there might be a shout out, as we say, to the promotores and community health workers. Am I correct?
Yes,
the
it'll
next
actually come up
slide.
in the next goal. That's right.
Speaking of that, let's move to that if we could. Gary, why don't you share a little bit about the behavioral health services?
I love it
Yeah.
when it works out like that, right?
Yes.
So here's our segue to our C, which is the goal of increased access to behavioral health services. And some of you may think about this as mental health services, behavioral health services. The first objective is to increase partnerships and collaboration with community partners and law enforcement to deliver services to people in need. Second is to utilize community health workers and promotores in tribal communities and among Latinx populations to reduce the stigma of seeking help for mental health. Third is implement Measure B plans to create a psychiatric health facility, crisis residential treatment facility, and behavioral health regional training center. And the fourth is, in conjunction with other health and human services departments, apply for additional grant funding from state and federal sources to address county needs. So there is a belief that there's some money out there, but it's going to require writing grants and going after some of that money. There was some questions when we did some other community groups regarding the CRT. Elizabeth, if you're on, could you let us know the status of this crisis residential treatment facility? Elizabeth is on our task force and I think had some information about that.
Thank you, Gary. Welcome, everybody. The CRT has been opened last month, and that is a crisis residential treatment that is, let's see, I have notes here, up and running, and it is located on Orchard Street. I know that if Supervisor Haschek was at the opening, he may be able to speak more on that, but the treatment center is open.
Nice.
Supervisor McGordy has some comments on that, I know.
So our commitment to behavioral health is huge here in Mendocino County, at least from the point of view of Board of Supervisors, and we're working through it. Probably not as fast as people would like, but under item 3. So we have the crisis residential treatment facility open, as Elizabeth talked about. We have our behavioral health regional training center open, and those were 2 things that were promised in Measure B, which is a sales tax increase that we assessed ourselves starting about 5 years ago. And we're working on the design of a psychiatric health facility, or a PUF unit, as they sometimes call it, by repurposing an older facility that was used for help me on. I'm forgetting the name of it. It was on South. Yes. So we're working through this because this is very, very important for us, because when right now, if someone has a mental health crisis, we pretty much have to send them out of county if it's a serious one. And that puts such a huge amount of strain on both the patient and the patient's families. We really want to keep our mental health patients home. And then not only that, there's a continuum of care that has to happen. So when someone goes into a PUF unit, they are there for a relatively short period of time where they stabilize them. Then they're probably going to need some assistance to come back into their normal way of life. And that's where the crisis residential treatment facility is useful. In addition to that, we also have really active programs for people who are struggling with addiction and alcohol abuse. So we're trying really hard in Mendocino County to have a caring and sort of multi-pronged approach to helping people when they're in crisis with mental health, addiction, or drug use.
I'm wondering too, if we could get Eisen in this conversation. Eisen's the head of probation, and maybe you can speak to law enforcement's role too, relative to mental health. I know many citizens end up calling law enforcement, calling the sheriff's department or others to get support when somebody's in a mental health crisis. Can you comment on any of the current programs, Eisen, or some of the work that law enforcement's doing in relationship with community partners?
Yeah, thanks, Gary. I won't speak for the sheriff's office or the the district attorney, but I'll tell you that we meet regularly as a law enforcement community with mental health in a collaborative effort to talk about these issues. In particular, I think across the state and the nation, there's a reexamination happening on law enforcement approaches to mental health. Mental health isn't criminal until the actions taken by the individual are criminal, but lots of times the underlying issue, if it had been addressed, wouldn't have led to incarceration. And even while incarcerated, there's still a push to be receiving services. I think, at the probation department, we always talk about providing opportunity and accountability. They go hand in hand, and there's a natural balance here. And I think in our community, it's important to remember, a co-responder model, working together with mental health and law enforcement in conjunction with our population, is strategically probably our best approach. And I think that's the conversation that's having, and that's where the grant funding is being examined to provide those types of opportunities and partnerships.
Nice, thank you, very helpful.
Gary, I do want to, just in the interest of accuracy, since this is a public forum, I do want to mention that the Crisis Residential Treatment Facility, although it had its grand opening and the building is done, they don't quite have their license yet. So it's not actually technically open. I did see there was a comment of somebody asking how they could access the services there, and I just want to make sure we're accurate for the public. I do think that it will be accepting people into the building and fully licensed within the next couple of months, but it is it's a beautiful building, and it's a really incredible resource for our community. So I do want to acknowledge that. I did want to comment, I do see a questioner asking a couple different times about mental health services for people who are not enrolled in Medi-Cal. I do think that's an important question, because typically in the county venue, we're almost always talking about services provided to people enrolled in Medi-Cal. And that is I want to acknowledge that is a void of people that are not on Medi-Cal feeling like there's enough support for them as well. There's the mental health infrastructure nationwide, regardless of your payer source, is not what it needs to be in this community.
Yeah, it's a shame, but it's true. It's true in Sonoma County as well. Just a real dearth of services and beds. Thank you.
Let's open it up to the public, if we could, Gary, to see what the public thinks about increasing access to behavioral health services. So let's go to that next slide, Anne, so we can have that question right out there for everyone to see. What are your questions, and mostly what are your thoughts? We really want your input. We want your ideas more than anything about ways to increase access to behavioral health services. And again, what do you like about the goal? What do you not like? What are things that we should be doing more of that we're not doing? What should we build upon that we already are doing? Go ahead and give us your feedback in the Q&A. And remember, if you don't have access and you need to email, please email us at govt strategicplan@mendocinocounty.org. Sarah, do you see anything coming in?
Yeah, we have some Facebook comments. Salad Pringle shares that building intentional and sustainable communities, small housing workshops of Miguel Elliott, workshops and grants to help sustainable communities acquire land. It sounds like suggestions. And I know we'll be talking about housing tomorrow.
Yes, tomorrow.
So hopefully they'll be able to join us and share more ideas and feedback. Again, we've got some more questions about mental health and behavioral health care at the county. And then Kathy Johnson also shares that 25% of California, the state of California, will be 65 or older as of 2030. The first time 65 plus individuals will exceed the 18 and younger individuals. What shifts can Mendocino County's public health system expect to have to address the needs of our aging community? So again, we love the questions. We really love ideas. And we're so excited to see folks who are passionate and interested in an inclusive plan, especially around our aging population. So
And
thank
I
you.
see one idea here, Sarah, we haven't
Great.
talked about in the context of the plan that just came in on the Q&A, which is expanding mobile crisis vans. And, presumably cost less, a cheaper kind of infrastructure, but also freeing up law enforcement to focus their attention on addressing crime and getting out there in the community in a different kind of way for interventions.
Great. And
And-
let me
and
also then throw that back out to Kathy. Kathy, if you have any ideas on what we can do to have a greater concentration, greater effort to serve the 65 plus population, give us your ideas. That's what we need. That's what we're looking for. in this
And
plan.
please post them in the Q&A too. I know a lot of folks are checking that tool out. And Anne also posted, and I hope our Facebook moderators can also share this in the Facebook chat, but if you have questions about mental and behavioral health care in Mendocino County, or perhaps you're even experiencing a crisis or a challenge yourself these days, Lord knows it's pretty tough out there these days of COVID and everything else, please call the Mendocino Crisis and Information Line at 1-855-838-0404. It's open 24/7, staffed by amazing folks, and it's free. So please call if you have questions or would like some assistance.
Thank you,
I
Sarah.
also have a comment on the Measure B situation. We do have, and perhaps Megan and Eisen can elaborate on this more, but there is a mobile response unit that goes out with law enforcement for any need they have for, let's see, better placement or
You want me to pick up
help
there,
with law
Elizabeth?
enforcement. So go ahead, Megan, you could take
So-
over on that.
Measure B is funding a mobile crisis van that is staffed for the outer areas outside Ukiah, and they've just hired an Inland Valley person as well. I'm not sure if that person's like quite active yet. It's not a 24/7 service. It's not it's a supplemental 8 to 5, regular working hour type of situation where there is a staff person who can accompany law enforcement for situations that require mental health help. But I do want to just provide, for what it's worth, some thoughts about this, and in response to a lot of the questions that the public are asking. This is clearly a really incredibly strong need in our community to enhance our behavioral health services, but nothing is going to be an easy fix in this topic. We are the victims of national trends. Finding psychologists and therapists, not just willing to work here, but willing to work at all. There's ability for therapists and psychologists to work online and have really cushy kind of jobs. So just the workforce issues alone are really critical. And then people experiencing mental health issues themselves sometimes are not open to that treatment, not willing to have that treatment. Is super, super difficult. So I think we have a ton of work to do in this area, but it's going to be slow progress. I'm excited to see so many people agreeing that it is a critical need. And we're going to be taking small baby steps along the way.
Thank you, Megan. Supervisor Hashak, is there something you wanted to say? And then we'll go to the next one.
Well, thank you. I was just going to say that with those mobile outreach programs that we have budgeted for 3 of these people. And the idea is to have one person paired up with the deputy sheriff, and they would go out together in case when there's a situation arising where they need a mental health person with the deputy to confront the situation. And we have hired 2 very good people so far.
That's great. Thank you for that. Good to know. Let's go ahead and go. We've got 2 more goals that we want to share with you. Thank you, Anne. And that next one is to help people feel safe in their communities. And the objectives that we've established so far are to develop new approaches for law enforcement organizations and criminal justice partners to work in coordination with other county departments and community-based organizations to reduce recidivism and incarceration. I'm going to ask Ivan to speak to that in just a little bit. And then to design and implement multiple layers of collaborative, community-oriented law enforcement solutions that are based on best practices in public safety to increase citizen engagement and understanding. And the third objective is to identify and implement strategies that prevent youth entry into the criminal justice system in the first place. So, Eisen, do you want to speak to any of this that would be helpful for the community to know what some of the thoughts are here?
Sure, I'll provide a quick general statement with regards to this topic. The criminal justice system in particular, like I mentioned before, I only speak for probation. And we provide, like I said before, accountability with opportunity. There's treatment and rehabilitation with consequences. You have to have a proper balance. Through partnerships and collaboration, agencies, departments, and the non-governmental organizations come together to share our knowledge and resources in an effort to achieve 1 through 3 on this list, with the overall goal of proper public safety. What might not be known amongst the public, though, is that there's lots of organizations and commissions that are in our county that work on these very topics. For instance, your Juvenile Justice Delinquency Prevention Commission, your Juvenile Justice Coordinating Council, your Community Corrections Partnership. These are all agencies that exist, or councils that have board support or a board member on them that are already in existence in our county, but they're tackling individual issues and not a collective area to bring information to the public as a whole. So I think number one is a venue that the county might need for public safety for an active engagement with the constituents and with the leaders of public safety and or the board, where they're able to talk about the overall situation, the overall desire of the community to feel safer and what's happening already. There are a lot of great things happening in our county. It just happens in the criminal justice vacuum, and lots of people may not understand that unless you're in the criminal justice system, which will taint your opinion depending on which side of the system you're on. So that's a quick nutshell of 1 through 3.
Got it. Thank you for that. Let's go ahead and open it up to the public. I see some comments coming in. And again, remember, let's go ahead and go to that next slide. And remember, if you can't access us through Zoom, go ahead and email us at govtstrategicplan@mendocinocounty.org. Gary, is there anything that you're seeing? And then we'll ask Sarah if she's seeing anything coming in.
It looks like we have some folks who are a little confused on how to send comments. Mary Beth it asks how they can contact the planning staff. Mary, if you can please email us. I just posted our email in the chat. You'll see it there. Please send us your comments and ideas. We appreciate it. And again, please try to participate in the Q&A. That way we can really track all your questions there. It looks like Judy asks what help is available for newly homeless on the coast. Walt also gives some ideas regarding safety. Thank you, Walt. Walt suggests that says that the plan fails to address the increase in crime due to no bail and early release policies of state and local government. He also states or asks, what is the rehabilitation rate of repeat offenders and is it improving over time? And what innovative approaches are needed to reduce recidivism? And I'm not really sure if we'll be able to get that data tonight, but we can possibly share it. Hopefully the county staff will be able to provide that data. Is the juvenile court and sheriff considering a scared straight or similar early prevention intervention program? Thank you very much for those questions and ideas.
Gary, are you seeing anything coming in? Any comments you'd like to make, Gary?
Yeah, I think no others. I think in general, though, when you see something in our plan, like design and implement new approaches, it's work that is TBD. We don't have those answers yet. And part of the work that I think the citizens can expect is the responsible departments to do research, to do an assessment, and then to create a plan for those improvement processes. So I think while some of the questions are really interesting, we just don't have the answers to some of those quite yet. That's part of the work that the plan is pointing us towards.
Well,
Right.
looks like we have a comment regarding safety, people feeling safe in their communities from Facebook from Ravina. The concept of community-based policing is already well vetted. What are we doing to implement those evidence-based practices and demilitarize our law enforcement? Thank you, Ravina, for that question and comment. Looks like also Patrick Hickey has shared in the Q&A, discussing feeling safe in our community without acknowledging some of the challenges brought by illegal cannabis and the criminal element it has attracted is ignoring a real challenge that part of the county faces. Thank you, Patrick, for that feedback. Any other ideas on what we can do? And it would be great.
Anything from our panelists? Any additional comments before we move on to the last goal of the evening? Any of our panelists have any comments at this point?
We actually have another comment from an anonymous attendee regarding the subject. If nobody
Sure.
has any panelists, please encourage and measure authentic law enforcement collaboration and community organizations and groups. This often does not come to fruition due to a variety of challenges, some of which are simply based on staff shortages, but ultimately puts more work on law enforcement as well as decreased safety, trust, and resources for community members. Thank you so much. Alima also asks how the county is working to make Black people in Mendocino County feel safe. Thank you, Lima, for that question.
That's great. All really important points that we'll be filtering through, thinking about, and finding ways to weave into the thoughts that we have here in the plan. And so the last goal of feeling having a safe and healthy county is for Gary. Gary, you want to share that with us?
Sure. The last goal deals more with environmental and natural resources versus people-centric. And it says implement practices that support a sustainable environment and responsible stewardship of natural resources. And there's 3 objectives identified here. One is on the heels of a pretty severe drought we've all witnessed. Develop a strategy for a sustainable water supply that includes the identification of potential new sources of water and/or expansion of existing surface water delivery systems. Second is reduce the carbon footprint of county facilities and operations by installing solar microgrids, purchasing electric vehicles, and reducing the use of fossil fuels. And the third is support sustainable forestry, agriculture, and landscapes as a county policy with a focus on lowering carbon emissions. So again, really welcome your comments if you have ideas or inputs on how to operationalize some of these objectives, or you have additional objectives you'd like us to consider, maybe other initiatives or other approaches that aren't on this page. Please put them in the Q&A. It becomes part of the public record, but it also gives the task force a chance to evaluate and really look through the inputs that we're getting from the community that will inform the final version of this plan.
And if you're confused on where the Q&A is, you'll see at the bottom of your Zoom is a menu with 2 chat bubbles, and it should have Q&A. Just click that, and you can type in. It might say type a question, but you can share your comments, support for a concept or an objective there. That'd be great. Thank you. Sorry, Gary.
No, that's okay. And one of the things I would say is that, and I think most of our audience knows this, that ultimately strategic planning is about choice, and it's about choosing the things that we think will make a huge difference in these different areas. But we can't do everything. No county can. And so if you think there are other priorities that are more important, please let us know what those are and why. Or if you have more effective ways to accomplish some of these goals, we'd love to hear your inputs too. And know that the final plan, when it's voted on, will be aspirational, but it'll be the direction and the alignment that the county leadership needs in order to deliver on these particular goals.
Thank you, Gary. Let's go with Supervisor McGordy has some comments.
So I just want to let everybody know that in many respects, Mendocino County is well ahead of the curve in this area as it goes to environmental friendly farming and forestry and and concerned for our forests and wildlife and fisheries. I think that we have a very progressive group of people and working in a lot of different places, whether it's agriculture, uh, conventional agriculture like wine grapes and pears, or cannabis, or our market gardeners, John Jevons and Alan Chadwick, this long history of people looking to find a better way to grow food and live in harmony with nature is something that's kind of an ethos for us. And I was part of it for 33 years and working on organic, biodynamic, and sustainable wine growing practices here in Mendocino County. And I assure you, we're well ahead of the rest of the state and really set a lot of the standards that the rest of California uses. When I look at cover cropping in other parts of California, it started here with our growers and research that I did. So we have a real leg up on this, and I hope that we continue with that. What's exciting to me is working on reducing carbon footprint in our county facilities. We made a commitment to solar, and we're looking at whether electrical vehicles are really feasible for us. The problem is that there's not a lot of chargers out there, so if you have to go very long distances, that becomes a problem. And the kind of driving we do in Mendocino County often involves a lot of driving. So point is, this is really on our radar screen, I think, as a board of supervisors. And I think our community in general, this is really, really important to us.
That's great. Thank you. Gary, we ready to open it up to the community for some final feedback on this?
I think so. So to the extent that any of you have ideas on this last goal about implementing practices to support a sustainable environment, responsible stewardship of natural resources, please put your ideas in the Q&A. Again, I know some of you are using chat. It's, I think, a little bit easier for all of us to navigate one source of your input. You also have emails that will become part of the record and reviewed by our task force as well. And we're really just looking for your input at this point. It's not a public meeting where you can stand in front of the dais at this point. I know some of you maybe came here expecting that, but we really are collecting input to enhance the quality of the strategic plan. Several comments about small cultivators in the cannabis industry, and Michael sharing that more licensed operators equals more environmental protections. So that speaks to our environmental piece. Thank you for your input. Sarah, are you seeing anything else we should be calling out in this?
Yeah, from Facebook, we're seeing a recommendation from Ravina about incentivizing xeriscaping instead of lawns. Lawns use 2 to 3 times more water than native plants. Native plants also tend to be fire resistant. Thank you, Ravina. And we want to hear all kinds of ideas you have, things you think you like in the plan so far, or how we can improve it, or maybe something that we're missing. We don't really have a chance to answer a lot of questions tonight, so ideas is where it's at. Looks like Patrick is suggesting it would be great if the county had a more extensive park system. We have a good number on the coast, but we would benefit with more inland access to nature for the public. This could also spur a little bit more tourism. The county is so beautiful, it'd be great to have more access to it. Thank you, Patrick. We're also seeing some suggestions from Finn to have solar panels all over parking lots and small dams that have a smaller impact on river streams, the way beavers operate. Anything that brings more beavers. I'm supposed to be neutral today, but anything we can see more beavers in the rivers, I'm about it.
Absolutely.
Thanks, Finn, for those suggestions. And Michael was asking about time to discuss questions. BJ, would you be able to address that and how this is a little bit different maybe than some past town halls or Q&As? Thank you.
Yeah, we're really trying to get input, feedback. It's as opposed to answering questions, we're trying to get your feedback, your ideas to help us add to this plan, to know what is good about it, what needs to be changed. So that's really what we're focused on at this point. We really want your ideas more than getting our ideas. We want your ideas at this point. Gary, any comments that you want to make about that?
No, I don't think so. Other than that, this isn't the only opportunity to do that, BJ. We have, in addition to tomorrow and the next night, other town halls, we also have the plan posted. And at people's leisure, they can go on, review the plan, and email us their input as well. So I've read a few comments that it's a little bit unwieldy. I think some people were expecting maybe more of a open conversation format, but I think this is a time now where we're trying to kind of collect inputs and use them to refine the plan. And people can do that at their own pace as well if they don't find this as easy for them.
And of course,
Exactly.
keeping with open government, you're always welcome to also contact your county supervisors. They provide us the feedback too, and we appreciate that we have two of them here tonight. And if they represent you, feel free to reach out to them, right, gentlemen? And they'll do their best to get back to you and take that feedback also, because I'm sure we've got a lot of civically engaged community members here tonight. I mean, it appears we do. So you can always reach out to your supervisors also.
I think Supervisor Mulheron's somewhere here too. I think I saw her earlier as well. So the questions are, I like your questions, but we really need to get your input so that we can really flesh out this plan and know what you like about it. Know what's
Yeah,
missing.
please go ahead, Gary.
Yeah, we have a couple more from Michael relative to cannabis. A couple other suggestions. One was to implement a best management practice program for cannabis cultivation. Thank you for that. And another idea to develop an ordinance that would enable small cannabis operators with small gardens on parcels of less than 10 acres to enter the licensed market. So while the plan doesn't currently talk about cannabis per se, it certainly has an impact on environment, water usage, and environmental protection. So thank you for those inputs.
Exactly. And tomorrow when we talk about the economy, I imagine that there'll be a lot more cannabis suggestions as well. So I can imagine that we'll be weaving into that. Any other comments that we see coming in? We've got about 1 or 2 more minutes of public comment that we can take. Anything else that we see here? Got some ideas. Right. All right, let's go ahead, and we really appreciate all your comments that we're seeing tonight. This is so helpful. Let's look at the very last slide at this point, and just want to let you know, Anne, that thanks for that, Anne. That we want to thank you for tonight, but we turn this over to one of our supervisors. But just want to let you know that we are encouraging you to attend the January 11th and 25th Board of Supervisors meeting virtually, because it's our understanding that there'll be some time that we're going to be presenting the plan back to them. So you'll see some of the changes, some of the additions that we've talked about tonight, perhaps being presented for you to see in a different way. So Supervisor McGorty, are there final comments that you'd like to make? And Supervisor Hashak?
Correct me if I'm wrong, John, but I don't think we have a Board of Supervisors meeting on the 11th. I think our schedule's been changed.
Ooh,
I think the 25th is our next meeting.
okay.
That's right.
Yeah.
Good to know.
Yeah, good
Thank
to
you.
know. Thanks. I'll update my calendar even as we speak.
Yeah.
Thank you.
So things are fluid around here. So thank you, everybody. I mean, this is your county, and in the end, that's why I signed up to be a supervisor, was to try to make things better. And all the things that are showing up in the strategic plan, very much what I ran on. I was worried about us taking care of each other and having a healthy environment, having adequate water, a safe place where we take care of ourselves and the environment. And it's been a pretty wild ride the first year. I mean, one of my friends said to me, "Wow, that year went by quickly," and I said, "No, it didn't." There was a lot to do. It was a very, very busy year, and a strategic plan is so important to us because there's a zillion things you can do, and we know that. We can go to a board meeting and there'll always be stuff to do. What is good about a plan is that you begin to organize yourselves into things that are important to do, so that you're not just doing stuff, but you're doing things that are important, that allow you to be prepared, allow you to respond to an emergency, allow for a future, allow for your community to grow in a way that's meaningful to you. This is why we do strategic planning. And hats off to Supervisor Haschak, who's been thinking about this longer than I've been on the board. I know that he's a big supporter, and hats off also to all of our task force who are working on this. There's other things they could be doing, and it's an imposition because it's on top of everything else they have to do, which they're already overloaded with. So I so appreciate it as a supervisor and also a colleague that all of you are working together with me. Thank you. And thanks all of you for attending and being concerned and interested.
Thank you. One comment I'd just like to make, if I could, I know some people are saying, are you seeing the comments? What's going to happen? Zoom, believe it or not, which is why we love the Q&A function, produces a spreadsheet with your comments on them. So we will be looking at that spreadsheet and incorporating those ideas into the plan. So yes, we see all those ideas. And Anne, I'm not sure, I guess we're going to be posting stuff on the website. So we'll be keeping you informed as we have been along the way. So yes, Lima, we see your comment. We see your final comment. Devin, yes, we see yours as well. So they will all be in the public record, guaranteed. Thank you for that. Supervisor Haschak, any final comments?
Well, I'd just like to thank everyone for attending. Your participation is really important to this process. Thank you to the team who's working on this, the staff who's participating and part of the task force. And really, we have 2 more nights of this, and we want your participation. So please tell a friend to attend, and we hope that it's interactive enough that we're getting your involvement, we're listening to you, and so thank you for your time this evening.
Thank you all very much. Good night.